Hello, and welcome to the AMA's Steps Forward podcast series. We'll hear from healthcare leaders nationwide about real-world solutions to the challenges that practices are confronting today. Solutions that help put the joy back into medicine. AMA's Steps Forward program is open access and free to all at stepsforward.org.
Hello, everyone, and welcome to this episode in the AMA Steps Forward podcast series. This is Dr. Jill Jin, internist and AMA Senior Physician Advisor. And today I am joined by my colleague, Dr. Kevin Hopkins, to discuss the latest playbook by the AMA Steps Forward series called The Value of Feeling Valued: How Organizations Can Support Individual Physicians. And I think everyone here knows you, Kevin, already, but do you want to take a second to introduce yourself?
Oh, thanks, Jill. I appreciate it. Sure. I'm Dr. Kevin Hopkins, a family medicine physician and a senior physician advisor here at the AMA.
Okay, so let's dive into this topic of feeling valued. So the idea of feeling valued sort of emerged during the COVID pandemic, as it was found to be one of the key mitigators of physician burnout during the pandemic. And one survey-based study that was published by Dr. Mark Linzer, myself, and some colleagues from the AMA back in 2022 showed that physicians who felt valued had a much lower rate of burnout than those who did not. And that difference was pretty significant. So among those who felt valued by their organization, there was a 37% rate of burnout versus those who did not feel valued by their organization had a 69% rate of burnout. So that is a huge difference. And those are absolute numbers. So that's a 32% absolute difference or reduction in burnout from feeling valued. So that was kind of a interesting and a little bit unexpected of a finding. But of course, that led to the follow-up question of, what can organizations do to make physicians feel valued? And that is kind of how this playbook came about, the question we sought to answer, and why we felt this was an important topic for us to cover. So we'll get into that as we cover many specific strategies and examples in the playbook. But I want to start, before getting into that, by asking you, Kevin, what does it mean to you as a physician as well as a physician leader to feel valued?
Sometimes it can be hard to explain. What does it mean to feel valued? I think we all can probably recognize when we don't feel valued and what that looks like, maybe a little easier. But in healthcare, we all know that we're here primarily for the patients. And yet, as healthcare workers, especially as physicians, we want to feel like our organization does value us. So to me, that means being known, being respected, being involved, being asked about things that might be changing or new workflows that might be developed, to have physicians involved in that process from start to finish. And while our insight and input might not always end up in the final version of whatever's being determined, to at least feel like we're being listened to and that our opinion and perspective matters. I think that's what it feels like to feel valued, that I matter, that I'm not just a replaceable cog in the wheel, that I'm not an interchangeable part, that I'm being treated as a human being with infinite value and worth, and with highly specialized, advanced training, knowledge, and experience.
Yes, yeah, absolutely. This concept of mattering and being known, that resonates with me as well. And what I noticed you did not say was anything about free food or wellness seminars or yoga classes. And I mentioned the food because we start off this playbook by talking about this concept of muffin rage, which was actually a term coined by Dr. Jillian Horton, who is a physician. She practices in Canada, and she actually wrote this op-ed for the LA Times during the post-COVID pandemic, as well as a couple of years back, about how when she was in the throes of burnout and she was really struggling professionally, how one day she was walking by during a physician appreciation day at her organization, and there was a table of muffins. And at that moment, instead of feeling appreciated, she was overcome with rage. And then she coined this term, muffin rage, to kind of describe how large of a chasm there was between what she needed as a physician from her organization versus what they perceived her need to be. So I use this example a lot to kind of illustrate this concept of the importance and the challenge of feeling valued, of making physicians feel valued, right? So how do we do that in a way that avoids the muffin rage? That's kind of the key question. Another thing that I noticed you did not mention was compensation, which I think is important, certainly, because physicians want to be compensated fairly, but probably not the primary factor for most physicians in terms of whether or not they feel valued. What do you feel about that?
Yeah, I want to be paid something that I think is fair and reasonable, and everybody's going to have different ideas about what that might be, right? There's probably nobody whose pay, whose compensation and benefits equals their self-perceived value. And so we can probably start from that point. Like it's probably going to be less than what you think it should be, but is it reasonable? Is it keeping up with market? Is it comparable to colleagues with similar background and years of experience and all those types of things? I think there's ways that we can have a more objective lens on our compensation.
Yeah, and I think it's important to have a transparent compensation model and just frequent communication about that and resources to help physicians understand, compensation and bonus structures, which can get very tricky. But I think it's the transparency and the communication behind it rather than the number itself that would factor specifically into the feeling valued part. Okay, so let's talk about the why. Why is this important? Besides, it's nice to be able to treat physicians like humans and it's the kind of the right thing to do. There is a business case as well. And so what can you discuss that a little bit more? Why is it important from a business perspective that physicians feel valued?
Yeah, you're right. So the moral case is probably much more easy and more direct, like because it's the right thing to do. We are human beings and we should treat each other with respect. When you think about the business case, really the primary factor in making the business case to practice and health system leaders about the importance of supporting individual physicians to demonstrate that they are valued is really rooted in what the cost of burnout is. So the cost of not doing that. The burnout rate, as you mentioned, for physicians, there's a differential between those who feel valued by their organization and don't. The burnout rate for physicians continues to be higher than people in comparable professional population. 48% in 2023, down from a high of 63% in 2021. And the turnover rate for physicians with symptoms of burnout is double the turnover rate for physicians without symptoms of burnout. So it's not hard to come up with the business case. Studies have shown that feeling valued is associated with lower rates of both burnout and intent to leave your practice. And obviously, we all know that there's a widening gap between the number of practicing physicians in the US and the number of physicians that are needed. And that widening gap looms on the horizon. It's only becoming greater. Even now, we're experiencing significant workforce shortages in healthcare, and it's not just for nurses and support staff, but for physicians, as many physicians are choosing to reduce their clinical time or retire early, even leave clinical practice altogether. I've seen and talked to physicians who never even went into clinical practice. They went straight from their training to a non-patient facing job. And some are choosing to step aside from a career in medicine altogether. So I think that gap is only going to become wider. There was a publication from 2019 that was based on the combined research efforts of the AMA, Stanford, and Mayo Clinic, and it estimated the cost of physician burnout in the U.S. at $4.6 billion per year. And that was 5 years ago, almost 6 years ago. The cost of losing a physician due to burnout is between $800,000 and $1.3 million, depending on the specialty. And that's based on numbers that are now old. So the estimated cost of physician burnout for your individual practice or health system can be calculated using one of our online calculators from the AMA, in which you plug in some numbers, and it tells you what it's costing your organization. As we may have mentioned, there's an inverse relationship between feeling valued by your organization and your intent to leave your practice within the next 2 years. And this is based on AMA organizational biopsy measurement work. And in a time when really the economics of the business of healthcare have become a lot more challenging, we have practices and health systems that are taking care of more patients, but maybe getting paid less for each one. And in that type of environment, we really can't afford to waste money on avoidable expenses. So really the business case becomes a lot less murky and becomes a lot more focused when we think of it in that context.
Yeah. Yes, absolutely. Okay. So let's dive into more specifics. We've mentioned the studies that have linked feeling value to both burnout and intent to leave or turnover. And The follow-up studies that have been done have really looked into how do we make clinicians feel valued. And a survey-based study based on, again, this is data from the COVID pandemic, but this was recently published just earlier this year, 2024 in BMJ Leader. It was a study that specifically looked at key themes that help physicians feel valued. This was also authored by Dr. Martin Stillman and as well as some colleagues from the AMA. And they found several key themes, and they were number one, physical safety. Again, this was during the era of COVID and PPE. Number two, compensation and pandemic related finances. Number three, transparent and frequent communication. Number four, effective teamwork. Number five, empathetic and respectful leaders. And number six, organizational support for individual clinicians. Now, we've touched on kind of the first five. At the very beginning, you mentioned this concept of mattering, being asked, feeling involved, being listened to. And we have many AMA resources that kind of cover the communication, the teamwork, and the leadership component of that all certainly play a large part in this idea of feeling valued. But that sixth bucket, this organizational support for individual clinicians or individual clinician well-being, is, I would say, the most nebulous one and the most challenging one for organizations to address. And that's where that gap between what the organization thinks that physicians need versus what they actually need comes into play. And I think not only is it the most nebulous, it's actually arguably the most important bucket. That's the one we've focused on in this specific playbook, is how can organizations provide support for individual physicians in a way that makes them feel like they matter. And we came up with 5 key strategies. So those are, number one, support schedule flexibility and autonomy. Number 2, support taking time off. Number 3, support professional development. Number 4, support individual resilience and self-care. And number 5, support care during and after trauma. So these are all described in the playbook, and we'll go through each of them here briefly. We won't go through everything, but we'll touch on each of these. So starting with scheduling, as any practicing physician, I'm sure will say, the schedule is huge, right? The amount of control an individual physician has over their daily, weekly, monthly schedule is such an important factor when it comes to job satisfaction versus dissatisfaction. So Kevin, how can an organization support schedule flexibility and autonomy for its physicians?
Yeah, autonomy is a tough word because it does mean different things to different people. And I have the honor of being the Access Medical Director for our primary care institute here at my organization in Cleveland, which can be a challenging job sometimes. But I always say to our team, if you really want to disengage a doc, start messing with their schedule without talking to them, without permission. Because it is really disengaging. So I think for physicians, having some degree of autonomy and control over your own work schedule can look like a few different things. It could be having input on what your patient care template, your clinic template design looks like. What types of slots and blocks do you have? What's the length? Those types of things. It could also be flexibility in daily or weekly work hours to help support work-life integration. We have folks who, for whatever reason, need to start later on certain days or need to end earlier on other days because of family and other responsibilities. And so doing whatever we can to accommodate that within reason, I think is certainly important, as long as we're continuing to meet the needs of the practice and our patients. Maybe the ability to place holds on appointment slots without having to go through an approval process. It might seem like a little thing, but to be able to look at the schedule and say, I know that this person who's coming in at 11 o'clock, I'm always with them for an hour. And so I need to hold that 11:20 slot to give me a little bit of extra time and to not have to get permission from somebody to do that. Certainly, we can't make everybody have hour-long appointments necessarily in every specialty, but giving docs the autonomy to be able to do that when they need it and when they know it's the right thing to do for specific patients and specific situations is a good idea. It might be the ability to work from home, doing telehealth, maybe because of illness or because of childcare or because of not having adequate space in the office. Maybe there's lots of reasons why that might be the right thing to do. And I think the last thing I'll mention is making sure that docs have unscheduled time for important panel management and administrative tasks. If all day, every day is filled with a patient in every 20-minute slot, back to back to back, it's impossible to do the work that needs to take place between patients or before patients or after patients without doing it at night at home. And nobody wants to do that. So whatever we can do to ensure that docs have some amount of unscheduled time for that important work that is also patient care. So what do you think is a reasonable amount of time to have unscheduled patient care time? What have you seen? What's your experience been like? What's reasonable to try to balance that out between the needs of the practice and the needs of the individual doc?
Yeah, I mean, I think that's a tough question because I can't give a number that's going to work for everybody because, of course, it depends on the practice setting, the specialty, staffing ratios, patient population, so many factors that go into that. But I think the answer is it has to be greater than zero, right? So for all the reasons that you just mentioned. I will tell you at my practice, at my primary care practice, for a patient or for a physician to be considered full-time 40 hours per week, they have 32 hours of patient scheduled time. So that leaves the 8 hours of non-patient scheduled time for these panel management and administrative tasks and the charting, et cetera, that you have mentioned. So that I think is great. Not many physicians do not have that. And there's been research that's being done in this field, this concept of patient scheduled hours to maintain a 40-hour work week, PSH 40, and how that varies among specialties and staffing, et cetera, what we've mentioned. But this PSH 40 number is something that should be looked at specifically from your practice, and whatever number that ends up being should be less than 40, and it should be something that is standard, right? That it's kind of adopted across all specialties and practices. All right, let's move on then to the second strategy, which was support time off. And we at AMA Steps Forward have talked about this quite a bit. We had a toolkit that was recently published called Real PTO for Physicians, as well as a podcast episode where I interviewed Dr. Diane Shannon and we discussed the importance of time off. So I won't get into it too much here, aside from just saying it's important, right? It's important to have time off for physicians in which they have clinical coverage, so they're not feeling like they need to be logging on to take care of patient care tasks. It's important to have a compensation model that includes time off. It is important to normalize the culture of taking time off so that physicians don't feel the guilt about burdening their colleagues or about not taking care of their patients during that time. So those are kind of the key points that we talk about. And again, we have other resources that I encourage you to look at regarding time off and the business case for supporting time off as well. Anything else you want to say about PTO, Kevin?
I'll just say, if you see patterns of physicians not taking their time off, and so at the end of the year, they have all these days that are banked that maybe they carry over to the next year, that can be concerning. I mean, we need to take our time off. And so not only do we need to have coverage and not come back to an overflowing inbox, but we need to actually take it.
Yeah, good point. All right. The third strategy then that we talk about is supporting professional development. What are the ways that organizations can do this?
Well, one is providing money to be able to do CME and protected time to do it. And I know that that might be different based on your organization, but it shouldn't be something that you have to do on non-work time and that dips into your family time and time for other responsibilities. Supporting time for professional development might also look like leaders asking about and supporting interests that we're passionate about. So we have primary care physicians in our system who've done additional training around weight management. And we saw a trend where some of those physicians were leaving primary care practice in order to go work in our endocrine metabolic institute to do solely weight management. And it wasn't necessarily because that's all they wanted to do. It was because they wanted that to be a significant part of their practice. So we tried to figure out ways that we could support that in their primary care practice so that they don't feel like they've got to transition to a whole different department or a different practice style. It could also be coaching and mentoring services, whether that's internal or external to your organization. But I feel like that's especially important for early career physicians and for physicians who have aspirations for leadership within their organization to have access to coaching and mentoring services.
Yeah, those are great examples. And yeah, I know you mentioned at the beginning how so many physicians are either finishing training and not even entering practice at all or leaving practice early. And I think just among those early new to practice physicians, that is so important. These opportunities for professional development to do what they want, to have time, protected time to pursue their interests that are in addition to their clinical work. I think that that's something that young physicians who, from a recruitment perspective, that really attracts them oftentimes even more than the salary, things like that. Okay, let's move on to the fourth strategy, which is supporting individual resilience and self-care. Kevin, I think you've done quite a bit of work on this, so tell me more about that.
Sure. So we know that the most effective mitigating factors and prevention factors for physician burnout are system level changes that can be made to make the work environment a more favorable one for physicians to deliver high quality care in. And yet we also know that it is important to support individual resilience at the individual physician level. So when you think about stress injury and when stress occurs, it results in a negative impact on our well being. It just does. I mean, there's no way it can't. Having some degree of margin availability, which I think of margin as the difference between your load and your limit, what you're carrying versus what you can carry. And so when you have some margin available, that leads to faster return to the normal state of well being. But if you don't have any margin, if your plate's constantly overflowing, stress can cause a more significant negative effect on our function. And it can be longer lasting. That can lead to fatigue, continued degradation of our functionality, can affect our mood, our relationships with others, certainly. And resilience, which I think of as like a rubber band, the sort of the ability to spring back from stress, strain, and tension. When we're resilient, it supports a return to normal function. But recovery might take longer if we're not as resilient or don't have as much margin. So inadequate resilience or another significant stressor happening on top of one before we've fully recovered can further decline our function to the point of exhaustion. And so this is why personal resilience is so important. Resilience supports a return to normal function after stress, but recovery from exhaustion and from burnout will take longer and be more challenging. It's like having an injury to a muscle and not taking care of it, and we re-injure it, and now it leads to bigger problems. So when we think of that type of physical injury, re-injury cycle that we commonly see in clinical practice, it's easy to say, well, you got to stop that. You got to stop the re-injury cycle and let it heal. Same thing is true for physicians when it comes to our well-being. We have to give ourselves time and space to heal, and we need our organizations to support that too. So just as in a musculoskeletal injury, not having enough training, strength, or flexibility can increase our susceptibility to injury, not having enough resilience and enough margin leads to further insult and injury down the road when it comes to our well-being. So one of the ways in which organizations can help support individual physicians to build their own margin and resilience is don't contact physicians during their time off. Don't call them, don't page them, let them enjoy their time off, whether that's an evening, that's a weekend, it's a vacation day. And we do things like delayed send of emails and that kind of thing so that people don't feel like they have to respond to an email or a message during their time off. And that can help. It doesn't fix it, but every little bit does help. It could also be avoiding meetings and other work obligations before and after normal business hours. I've seen a lot of medical practices and organizations have mandatory physician meetings at 7 a.m., or I've seen it earlier even, or at 5 p.m. or later. I don't want to do that at those hours. I want to be home with my family having dinner. I want to be doing something else that is not work related that makes it so I'm able to come back to work the next day. We can help by allowing physicians to limit their commitments, give permission to say no to things, limit unnecessary meetings or interactions that are work related. We can also think of ways to help limit distractions for our physicians. A lot of us work in chaotic environments where it's loud. There's a lot of distractions going on. A lot of organizations have gotten away from private physician offices in order to maximize the use of every available space for clinical care, which you can certainly understand from a business perspective. But then we end up working in cubicles or in a desk in an open area. And so thinking about ways that we can create distraction-free workspaces, being very intentional when we consider cognitive load in our workplace design, eliminating unnecessary alerts from phones, from our computer screens, reducing pop-up alerts and things that actually interrupt our thought, thinking of ways to organize and batch communication. Maybe we don't need to send email reminders 5 times a day for something, maybe we could do a once a week newsletter that people might actually read that has the important information in it. And then also encouraging physicians to take breaks. I can't tell you the number of physicians that I see that their clinic schedule runs right through any type of lunch hour. So that's not good for us. It's not good for our staff. Building lunch breaks into our schedules should be an expectation. When you think of meetings, limiting those to 45 minutes, even for our administrative partners, because just as I'm exhausted seeing a patient after a patient after a patient in 20-minute slots going back to back to back, it's also exhausting. And you don't take breaks to take care of yourself if you're going from a 1 hour meeting to a 1 hour meeting to a 1 hour meeting back to back without any breaks in between, not even time to go to the restroom. So I think there's a lot of opportunities that we can build into our culture, that it is important to build personal resilience, making sure we're giving adequate PTO days and making sure people take them. For our leaders, we should be leading by example in this. We should clearly articulate what the PTO policies are and how physicians can be in alignment with them and still take their time away. So that's a whole bunch of examples of things for us to think about, but ways that we can help support individual resilience for our docs.
Yeah, those are great specific examples. And you mentioned the word culture, which I think that's the crux of it all, is you just have to work on shifting the culture where these things become acceptable, because it's very hard for an individual physician to change things, right? To say, I'm going to take an hour lunch, or to say, I'm not going to respond to an email, or I'm not going to go to that 7 a.m. meeting. It really has to be a cultural change that comes from the top down for this to be effective. But yes, I think those are great examples, and this is so important. And yeah, it's so important.
I'll say one more thing that's culture related is, Jill, even when you and I trained, sort of the culture of working in medicine was just keep your head down, grind away, don't complain, push through it. And for better or worse, we can debate whether it's right or wrong, but the culture of sort of the modern generation of physicians is not that way. They don't tend to accept that as much as we did. And so the culture is shifting and changing. And in order to attract physicians into, especially in primary care, but in order to attract people to go into careers in medicine at all and retain physicians with a career in medicine, we have to shift the culture in order to meet the needs of those who are delivering the care.
Yes, absolutely. I think during the recruitment process, I think these questions are being asked more and more specifically, regarding the schedule, regarding the support staff, all these kind of specific questions that you just mentioned. I think they are becoming more and more important, which is the beginning of a culture shift, I think, which is a good thing. All right. So the final strategy that we talk about in the playbook is to support physicians during and after trauma. And of course, trauma can refer to anything from the global pandemic to personal trauma related to an adverse patient event, for example. The organization should have programs in place to support physicians during and after such events. So, Dr. Hopkins, can you tell me more about that?
Sure. Yeah, I think organizational programs that are committed to promoting resilience following adverse effects are vitally important, because we know adverse events are going to happen. It's just the nature of the field in which we work. We probably all can remember, our first adverse patient outcome. First time we lost a patient. I can remember that very vividly. I remember my first code that I responded to in the hospital overnight as a third-year medical student, and doing chest compressions on the floor, and the patient didn't make it, and trying to process that as a 24-year-old kid, really, who was ill-equipped to do so. And I carried that with me for a long time. And practicing physicians are no different. And there's not just adverse patient outcomes. There's things like being named in a lawsuit. If you practice medicine long enough, it's going to happen. And so being proactively prepared for those things and then reactively supportive for those things is a really important step to take. So these programs are described in detail in several AMA Steps Forward resources, but things that would be included in this are things like a formal peer support program using validated methods and tools such as the stress first aid framework. That's one possibility for how we would provide support for physicians during and after trauma and stress. Could also be access to confidential mental health services for physicians as part of either an internal or external employee assistance program. And certainly more and more important is suicide prevention plan, as well as suicide response plan. The research shows that in the US, almost every day of the year, a physician commits suicide. And so it's probably not if, it's when, doing what we can to prevent those tragic events from happening, and then also having a plan in place to support those who need it most if and when it does.
Yeah. Yeah. And those mental health services for physicians are so important. I think a lot of times, especially recently in the COVID era, this idea of professional burnout has been used interchangeably with actual mental health diagnoses. And it's not the same, right? Some people have burnout, but some people have more than burnout. They have anxiety, depression, substance abuse issues that need to be treated on a different level. So I think that needs to be recognized by organizations as well. Not everything is just burnout. There are additional services that need to be offered to physicians who are struggling with more than just professional burnout.
Absolutely. And just as physicians' propensity is to ignore our own physical health, we also have the propensity to ignore our own mental health. And it's not good for us. It's not good for our patients. It's not good for our organizations and health systems. And so we need to have the time, space, and resources to be able to take care of ourselves in that way.
Yes, absolutely. Okay, so I think we've covered the main strategies that we discussed in the playbook. Of course, there's many more examples and details in there that I encourage everyone to look through. But I think the bottom line is that feeling valued is important. It's important for physicians and other clinicians, nurses, et cetera, for the people to feel valued by their organization. And it ends up being a win for all, right? A win for the clinicians, a win for patients, and ultimately a win for health systems. Anything else that you want to add, Kevin?
I think just like you said, I think earlier, maybe Jill, the tendency for health system leaders is to assume that we know what physicians need. And in most cases, it's not a muffin. It's not a cup of coffee, although some days it is. But to ask, really just to ask our physicians, what do you need? What would help you to feel valued? What would make a difference in your day-to-day work that would continue to help us make this place and this environment an okay place to come back to the next day, a place where you're not just trying to survive, but where you can ultimately thrive?
Yes, absolutely. Okay. Well, thank you all for listening to this episode of the podcast. And be sure to check out the playbook, which we will link below in the description. Until next time, everybody, take care.
Thank you for listening to this episode from the AMA's Steps Forward podcast series. AMA's Steps Forward program is open access and free to all at stepsforward.org. Steps Forward can help put the joy back into medicine by offering real-world solutions to the challenges that your practice is confronting today. We look forward to you joining us next time on the AMA's Steps Forward podcast series. stepsforward.org.